Welcome to Seven Figure Chiro, the podcast that is all about taking your chiropractic practice to new financial heights. We're your hosts, Dr. Jeff and Kristin Berard.
And twice a month, we are here to share the insider strategies, tools, and success stories that will help you scale your chiropractic practice to seven figures and beyond.
Whether you're at the start of your journey as an associate or you're ready to take your practice to the next level, we've got expert interviews, strategies, and inspiring stories from chiropractors who have turned their dreams into a reality.
So get ready to take your chiropractic practice to a new level, and let's crush your vision for success.
Welcome to Seven Figure Chiro. I'm your host, Dr. Jeff Berard, along with Kristin Berard. And today we're going to talk about the benefits of integrating PT and Chiro. And this is a sequel to episode 17. We're actually going to talk about how we do it in our office. We talked about, why would you integrate physical therapy with PT, but how do you actually do it in the office? Like, how do you integrate Chiro patients with PT and PT with Chiro? So let's discuss that today. And just for the record, I don't know if people know that, but Seven Figure Chiro is helping consult chiropractors to integrate physical therapy into their business. And for that matter, we can also help physical therapists integrate chiropractors into their business. It's something that we do. It's something we're good at. We've done it before and we know how it works. So please, at any time, if with any interest, go to sevenfigurechiro.com, shoot us a message and we will contact you. So back to the details. How do we do it in our office? As we described in episode 17, there's a lot of benefits of integrating PT into a chiropractic business. And I think those that listen to that episode understand it and agree with it. But how do you do it? So I'm going to walk you through a typical scenario that happens every day in my office, and it will lay out how it's done. So of course, we get a new patient that comes in. The new patient comes in and they have, let's say, the most common complaint. They have low back pain with intermittent neuropathy, L4, L5. It's not always there, but it's come and gone for the last 2 or 3 years. It seems to be increasing with frequency, intensity, and duration over the last 6 months. And, they're not getting any help. They went to their primary. Their primary told them that they gave them medication or told them whatever. It doesn't matter. So typically, without having PT, we put them on a chiropractic regimen. We would adjust them. We would do all these things and we would treat them and hopefully, once they're better, they're discharged. And in order to really give that patient, in my opinion, what they need things other than just manipulation, right? They need a sound assessment to test their functional movement. They need sound assessment to test their balance and their strength, different symmetries, what have you. So we have a system in our office where, yes, the chiropractors do that in the evaluation. I do that in the evaluation. But if I want to provide this patient what they need, some therapeutic exercise, some neuromuscular education, some manual therapy, and I follow the compliancy of the insurance company, I'm going to be with that patient for 45 minutes. If I want to bill, the amount of codes that need to be billed, they're timed codes, you have to be with them for a long time. So although I have the ability to provide that great service, it stymies my business to monetize itself because we can only see so many people. So bringing physical therapy, you can still have the passion and recommend the services that you would normally do, but you offload those services on another doctor of physical therapy who actually can perform those services and spend the required amount of time to provide the services in a compliant manner. So this patient comes in, I assess them, and I say, listen, we do things a little differently here. We have an integration model where we provide physical therapy. You have the autonomy to get physical therapy wherever you want. However, due to the convenience of our office, we can provide it here too. And we will collaborate. I'll talk to the physical therapist. I'll share with him or her the findings I have. We'll work collaboratively together. I will provide mobilization. I'll reduce your subluxations. I'll work on your arthrokinetic inhibition. The physical therapist is going to complement everything that we do on this side by stabilizing and making sure that we restore your dysfunction so that when you leave here, the relief you get is sustainable. How does that sound? Of course, the patient always like, well, it sounds great. Great. I'll walk you up front. I go up to the front desk and I say, okay, Skylar, here's patient X, Y, and Z. They're going to do the Chiro-PT model, and if you can get them scheduled, I appreciate it. Boom. They get scheduled 3 times a week for 2 weeks with the Chiro. 2 times a week for 6 weeks with the physical therapist, and we're off and running. Patient comes back for their initial initiation of care. They come to my office. I give them a 5-minute adjustment. I say, let's go see the PT. They go off to the PT. They get an hour of physical therapy. Their visit's over. It's that simple. As opposed to if you were to treat that patient and give them 3 or 4 codes of physical medicine codes and an adjustment, just think about the laborious process of documenting all that stuff in a compliant manner that the insurance company will accept. Good luck. We've tried it, we've done it, and it's a problem. Even though the insurance says they'll pay for it, if you get busy like we are, you go through audits and they throw all these red flags because you're going to be an outlier with every other chiropractor. Offload all those codes onto the physical therapist. They're better at documenting than we are when it comes to physical therapy codes. That's what they're trained to do. Let them do it, right? And when the patient goes to see the chiropractor, prior to the patient seeing the physical therapist, I go to the physical therapist and I say, hey, PT, this is so-and-so that I'm referring to you. This is their x-ray findings. Let me show you their MRI. This is what we talked about. This is what I told them their expectations are. This is how I said we're going to address this problem. And now that physical therapist has a summary of this patient. When the new patient comes into PT, the PT knows that we've already collaborated and we work together. And that peace of mind that the patient has such a healing effect when they come to our office, exponential compared to non-collaborative care. And not only does the patient benefit from it, but the providers benefit from it because you're offloading the burden of having to, it's helpful to have another doctor, another set of eyes on that patient to, maybe turn over rocks that you haven't turned over. What else could it be? What other services can we provide? I can assure you it enhances care. It enhances revenue, and it enhances your credibility, not only with the patient, but in the community.
Just reflecting on what Jeff just said, when he was talking about the Chiro-PT model, some of the chiropractors that are listening are a cash-based business. But I would have to assume that the majority of chiropractors and physical therapists are utilizing insurance with their patients. And so one of the things, because I'm not a doctor, that I had to learn and I found baffling is that as a chiropractor, if Jeff had a patient who had an issue, and let's say they have low back pain and he's adjusting the spine at the lower part of the body, he can't treat the same area with therapeutic exercise or manual therapy. Is that correct?
Well, it's different for every insurance company. It depends on the insurance company. So
right. So what I'm saying is what we've realized is to be compliant with these insurance companies is it's better because you are able to give the treatment that these patients need. And you're able to provide those services because you're able to do your chiropractic care following the insurance standards and regulations. And then the physical therapist, being a different provider, is able to treat those same areas that those patients need to work on because they are going through 2 different treatments per se with 2 different providers. And they really truly are getting the best care because they're not having to work around all this red tape. And so I think that's why the Chiro-PT model works so well, is it allows the 2 different providers to provide the best possible service for the patient in the same treatment plan.
So another layer that is extremely beneficial is, I talked about how we recommend physical therapy to our chiropractic patients, not all of them, those that need it. Once your physical therapy business starts to build up steam, because it will, and you'll start to get patients from the outside coming in seeking physical therapy, you build that trust and you share your knowledge with the physical therapist. Now, guess what? Now the physical therapist will integrate physical therapy patients into chiropractic, and you develop this synergistic model that literally feeds itself. So it's just a great new patient acquisition tool, and undoubtedly you're going to get better results incorporating the 2. I think any chiropractor will agree with that. Now, again, if you're a purist and you're absolutely not, you're a straight chiropractor, you don't want anything, well, then don't do it. this isn't for you, but if you literally want to double your business just by expanding the line of services you offer, it's a no-brainer to do, and you're going to explode your new patient acquisition and your revenue just by adding the service. I mean, it's literally that simple. Something that I found too when I talk about credibility is, now that you have PT in your clinic, you start to see conditions of all sorts, foot problems. And I know as chiropractors, you see it anyway, but now you have a whole nother set of tools in your bag where you can offload those conditions that take a lot of time to treat. So for example, I get a ton of patients that come see us that, have shoulder problems or hip problems or knee problems. And yeah, they know they need surgery down the road, but they're trying to kick the can down the road. And this is an opportunity for you to develop some sound relationships with other providers, orthopedic surgeons, spine surgeons, foot surgeons, hand surgeons, all these people that you see that are coming to your physical therapy department or coming to you because they know you have physical therapy. They know that surgery is a potential when someone has a diagnosed rotator cuff tear or labral tear or, advanced degeneration of their hip or their knee. You take them through this physical therapy, and sometimes physical therapy doesn't work, but guess what? If it doesn't work, you still have a team of specialists that you can help them navigate so they see it through the end. So guess what? Now they go get their surgery. Who do you think they're going to come back to for PT? They're going to come back to you. So it's a great model to keep those patients engaged and keep the continuity of their care and the continuity of your knowledge of their condition through the entirety of their journey to get well again. So that's a huge layer that I don't want people to dismiss is your ability to develop these relationships outside your office who maybe provide a service that you can't provide, but they will definitely reciprocate with patients that are in need of your service. Good luck getting that as a chiropractor. And we all know that. And, I've been practicing for a long time. And are there physicians that refer to me? Sure they are. But I mean, do I have pages and pages of physicians that are dying to get patients in to see me? No. Do I have a lot of physicians that refer to me post-surgical or pre-surgical? Or absolutely. So again, you're just broadening the net that you're casting, and you're able to see way more people, and you're able to offload the burden to other providers that can also take part in this healthcare journey that these patients that you see are on.
One of the biggest things when we started kind of expanding our business after we realized how well it was working together and talking to other chiropractors in the field and also adding other services like our stretch center is one of the biggest statistics is 15% of the population typically only sees a chiropractor?
It's give or take. Yeah, it's around there.
If only 15% of the population sees or has seen a chiropractor, you have 85% of the population out there that is not exposed to your services. And if you're only offering one service, you're limiting the amount of people that you can expose you, your clinic, your services, all those things that your business offers to. And so one of the best things about PT is typically if somebody hurts themselves, they will come in as a PT and then they will see all of these other things that you have to offer. And at that time, it gives them an opportunity because typically the average treatment plan for PT is about 12 visits. It gives them an opportunity for 12 visits to see, inquire, talk about all these other things that they can do in your business, and it exposes them. And so when they're done with their PT care, if they're not already doing PT-Chiro model and they're just coming in for PT, they're likely going to transition to a chiropractic patient or any of the other services that you offer, especially the ones that we've talked about with massage, assisted stretching, acupuncture, nutrition, those types of things. So PT and Chiro, when you have those two things, those can become now your main services. And then the other services are kind of ancillary services where people transition to in between their treatment plans and plan of care based on the different conditions or pains that they may have. And so it's a good opportunity. You don't want to limit yourself on the amount of people that you're able to bring into your door. So this is just one more way that you're marketing you're being exposed to the community. And for us, because we are a sports rehab clinic, we have developed a huge footprint in our community. And now we manage all of the athletic training programs for our local public schools. And so we're able to also, from a chiropractic side of things and from a physical therapy side of things, be able to expose ourselves into the school system with the services that we offer and present how we can help their students prehab, rehab, and maintenance. And so it gives plenty of opportunities to expose yourselves not only to the community, but also to all of the parents and the students and all of their siblings. And so there's a lot of opportunities out there when you add additional services. And the Chiro-PT model, I would say, is probably one of the best integrations I have seen in an outpatient clinic around.
Kristin mentioned something, and we don't have a marketing team that goes out and markets to physicians for referrals. We have a really innovative way that brings loads of new young patients into our office, active patients, athletes, all demographics. We don't go knocking on physicians' doors or anything like that. So I urge you, if you want to learn more and you want to integrate physical therapy into your practice, and if you see a reasonable amount of people in a week, like I said, 125, 150 patient visits a week, or if you're not even there yet and you want to catapult and grow quicker, I urge you to reach out to us at sevenfigurechiro.com, and we will be happy to help you navigate that. I hope you found this discussion helpful, and I hope that you consider adding physical therapy to your business if your objective is to provide amazing service, have patients get amazing results, and build amazing credibility in your community. Until next time, I'm Dr. Jeff, and keep up the good fight.
Goodbye.
Thanks for tuning in to this episode of Seven Figure Chiro.
We hope you're walking away with some valuable insights to apply to your practice.
Remember, building a seven-figure practice doesn't happen overnight, but with the right strategies and mindset, it's absolutely within your reach.
If you enjoyed today's episode, don't forget to subscribe, leave a review, and share it with your fellow chiropractors who are on the same path.
And be sure to join us the next episode for more strategies, bring clarity to your vision, and elevate your financial practice to success.
Until then, keep pushing forward and making an impact.